collaboration is really the cornerstone of innovation in research. And specifically, if you could bring people together that have a common interest but different backgrounds, so people from diverse areas, that's really when science is able to take off. So you bring someone from one part of Texas that's looking at a problem from a completely different angle in a completely different discipline, and someone from another part of Texas that looks at it from a different angle. Those people start talking, and now they can answer questions that previously couldn't have been answered. I think for me, what is key about this is learning and hearing and really deeply listening to what people are doing. Both, what are the problems? So hearing from people who are survivors and have the stories of survivors. What is it that they want and need? What are the problems that they think are important? And then learning what are the other areas in TRC4 in Texas that people are working on, so that way we can take that knowledge and go back to our institutions and share it with others and say, hey, I know you're working on this topic, there's another person somewhere else in Texas who's also working on that problem. I think it would be good for you to meet with them. And that, I think, is where we're going to start to see the fruition of this idea and this vision that Dr. Bynum and Dr. Stewart and Dr. Lakey put together. Trauma is the most costly and the most impactful disease process that we see. It is, over $1 trillion a year according to the CDC, which is 3 or 4 times more than cancer, diabetes, and heart disease. And the challenge is that we've never had trauma as a focus as a disease process. And so you have all people working on it in all these different areas that never really come together. And so if we can name it as a disease process and we start to work together and raise awareness and start to study it together, that's when we are going to start to make an impact. And it's so important because not only is it the cost or the number of lives lost, right? So it's the #1 cause of death in people under 46. It also impacts long-term people's ability to work and give back and be part of society. Because trauma affects mostly young people, right? If you think about cancer, diabetes, heart disease, these are things that hit people later in life. But trauma, we really can make an impact at someone early in their life and have that impact really sustained throughout their career. Even though trauma is the most costly, the most impactful, has the biggest impact on young people, the amount of funding that go towards trauma is extremely low. And again, the reason is because we have cancer centers, we have heart centers, cardiovascular centers. We don't have trauma centers as centers of excellence for research. And in order for us to really address this problem, we need to have it as a center, and it needs to be a focus where funding is going. And it has never really historically come from the National Institutes of Health. And so I think if we could really show that we can have an impact first locally within Texas, then we can start to show that, hey, we can move the needle, and now we should be thinking about this more nationally.